Dear students, welcome back. Today now we are going to discuss about the soft parts of the viscera and also the visceral organ called stomach. Okay, before we'll discuss about stomach, so we are going to discuss about some of the abdominal part of the esophagus. Okay. So the abdominal part of the esophagus is only 1.25 centimeters long. It enters the abdomen through the esophageal opening of the diaphragm. So we know that. So here the opening of diaphragm, that is called esophageal opening. Through this opening, this esophagus enters into the abdomen. This opening is situated at the level of T10 vertebra, which is slightly left side of the median plane. So which is slightly left side on the median plane. Okay. Now, the esophagus, once it enters into the abdomen, it runs downwards. So it runs downwards, okay, and to the left in front of the left crust. We know that. So the abdomen is having a right crust and left crust, isn't it? So in front of the left crust of the diaphragm and also inferior surface of the left lobe of the liver. Normally left lobe comes up to this side, left side. So as we know that the first layer of the abdomen includes the liver, stomach and the greater omentum, isn't it? So this esophagus, once it enters into the abdomen, so it runs downwards and to the left in front of the left crust of the diaphragm and inferior surface of the left lobe of the liver. So normally here like this, so this becomes the left lobe. Behind the left lobe, so this esophagus is present. Okay, yes, and it ends as by opening into the cardiac end of the stomach. So this is called as cardiac end of the stomach at the level of T11 vertebrae, about 2.5 centimeters to the left side of the median plane. So this is about the situation of the esophagus. Okay, and along with esophagus, some of the vagal nerves I have already mentioned in the abdominal part of the autonomic nervous system, that anterior vagal trunk and posterior vagal trunk will also enters into the stomach, enters into the abdomen along with the esophagus through esophageal opening. Okay, normally the left vagal forms the anterior fibers and right vagal forms the posterior vagal trunk. Okay, this is about the esophagus related to the abdominal part. Okay, so, and we have discussed about esophagus vastly in thorax. You can follow there the clinical anatomy of the esophagus once again. Okay, now we will go to discuss about stomach. Yes, the stomach is a muscular organ, or we can call it as a bag or an organ, forming the widest and most distensible part of the digestive tube. It is connected above to the lower end of the esophagus, okay, and below it is connected to the duodenum. It acts as a reservoir of food and helps in the digestion of carbohydrates, proteins and fats. Okay, if you see the location of the stomach lies obliquely in the upper and left part of the abdomen. So here we can see in this picture it is present on the upper and left part of the abdomen, and which is occupying the space called as epigastric. So this is occupying the epigastric, okay, and left hypochondric region. So this is the left hypochondric region, and also the umbilical region. So it is occupying the epigastric. So here some part of epigastric region and left hypochondric region and the umbilical region. Okay, and most of the part of the stomach lies under cover of the left costal margin. So here you can see the left costal margin. So the stomach, most of the stomach lies under the cover of the left costal margin and the ribs. Okay, this is the location. If you see the shape and position, the shape of the stomach depends upon the degree of distension and that of surrounding viscera. Okay, for example, colon. So the shape is depending upon the distension. Distension means when the stomach is full, it will distend more. If the stomach is empty, there is no that much of distension to the stomach is seen. Or sometimes if the other visceral organs, so which are accumulated with fat and all, so then also the shape of the stomach is going to change. Okay, now for example, when the stomach is empty, it appears as J-shaped vertically. When it is partially distended, it becomes pyriform. Okay, and in obese person, it is present almost horizontal. Okay, J shape when it is empty, almost vertical, and next one is the pyriform, and next one is the horizontal. Okay, next, if you see the size and capacity, the stomach is very distensible organ. It is about 25 centimeters long. So the stomach is 25 centimeters long, and the mean capacity is 1 ounce at birth, and at puberty it is the capacity is 1000 ml, and 1.5 to 2 liters seen in most of the adults. So these are the features where the stomach is located, its shape and position, and size and capacity. Okay, now we will see the external features of the stomach. So the stomach has 2 orifices or openings, and it is having 2 curvatures, okay, or borders, and 2 surfaces. So externally the stomach is having 2 orifices, so 2 openings are present, okay, and then 2 curvatures. So you can see this is one curvature and this is another curvature, and 2 surfaces, one is this side and opposite to other side will have the other surfaces. Now we will see the names of that surfaces also. Yes, first we will see the orifices. It is having 2 orifices. One is the cardiac orifice and the pyloric orifice. The cardiac orifice is joined by the lower end of the esophagus. So this end, cardiac end, is formed by the joining of the lower end of the esophagus. It exactly lies behind the left 7th costal cartilage from 2.5 centimeters from its junction with the sternum. Normally it is at the level of T11. Okay, if you see the pyloric orifice, this pyloric orifice opens into duodenum. So this pyloric orifice opens into duodenum. In an empty stomach and in the supine position, it lies 1.2 centimeters to the right of the median plane. So if you see this thing, this is the median plane. It is present 1.2 centimeters to the right of the median plane at the level of the lower border of the L1 vertebrae. So this pyloric end is located at the level of L1 vertebrae, or we can call it simply transpyloric plane. At the transpyloric plane, this pyloric end is present. Okay, how can you identify this pyloric orifice? It is having a circular groove. So this pyloric end is having a circular groove. Okay, it is due to by the underlying pyloric sphincter. So inside this circular groove, it is having a sphincter. Because of this sphincter, it appears a circular groove on the outer surface. Okay, and also prepyloric vein which lies in front of this constriction. Okay, so by that way we can identify the pyloric end. Okay, now we'll move on to the curvatures. We can see the curvatures now. It is having two curvatures. One is the lesser curvature and another one is the greater curvature. So the lesser curvature is concave and forms the right border of the stomach. So this lesser curvature, actually the right border of the esophagus continues as the lesser curvature here. Okay, so it forms the right border of the stomach, and the lesser curvature provides the attachment of lesser omentum, attachment to the lesser omentum. Okay, next is the greater curvature. This greater curvature is convex and forms the left border of the stomach. It provides attachment to the greater omentum and also the gastrosplenic and gastrophrenic ligament. At its upper end of the greater curvature presents a cardiac notch. It presents a cardiac notch there. Okay, which separates the stomach from the esophagus. Okay, these are the two curvatures. We have finished the two ends and two curvatures. Now coming to the surfaces. So if you see the surfaces of the stomach, so it is having anterior or antero-superior surface. So it is having anterior surface or antero-superior surface. So this becomes anterior or antero-superior surface, and the other surface is called as posterior or posterior-inferior surface. That means this part of the stomach becomes superior and the opposite side of the surface of the stomach becomes the inferior surface. So antero-superior or posterior-inferior. So how this surface faces? This anterior surface or antero-superior surface faces forwards and upwards. It is facing forward and also upwards. Whereas this posterior surface faces backwards and downwards. So it is a schematic representation. That means the stomach is present like this. Okay, that means this becomes the antero-superior surface and this becomes the posterior-inferior surface of the stomach. Okay, so this is about the external features of the stomach. And also the other important features of the stomach are, so that is the divisions. So the entire stomach is divided into two parts, and further it is divided into four. Okay, the stomach is divided into two parts. One is the cardiac and pyloric part. Okay, so this cardiac and pyloric part, how it is divided means, the pyloric at the lesser curvature, at the near the pylorus, it is having an angular notch. So it is having an angular notch called as incisura angularis. So from there, if you draw a line downwards and towards the left from the incisura angularis, so this divides the stomach into larger cardiac part, this is the larger cardiac part, and smaller pyloric part. Now this larger cardiac part is again subdivided into fundus. This is the fundus. So this part is called as fundus and the body of stomach. Okay. So subdivisions of the stomach, mainly the stomach is divided into cardiac part and the pyloric part. Again this cardiac part is divided into fundus and body of the stomach. Body of the cardiac part of the stomach. Next one is the pylorus. The small pyloric part is further divided into pyloric antrum and pyloric canal. If you can see, this is called as pyloric antrum and this one is pyloric canal. So this pyloric part is again divided into two parts. One is pyloric antrum and pyloric canal. Okay, so totally how many? So total two parts, and these are subdivided into four parts. Okay, now we will see the cardiac part. The fundus of the stomach in the upper convex dome shaped part situated above a horizontal line at the level of the cardiac orifice. So here from the cardiac orifice, if you draw a horizontal line towards the left side, it forms the fundus of the stomach. Okay, next one is the body of the stomach. Normally this body of the stomach lies between the fundus and the pyloric antrum. So from the fundus to pyloric antrum, this becomes the body of the stomach. Normally, and it can be distended enormously along the greater curvature. The body especially is distended along the greater curvature of the stomach. Okay. And normally this part of the body consists of gastric glands, which is also distributed to the fundus and the body of the stomach, which mainly consists of three types of secretory cells. One is the mucus cells and chief peptic cells, which secretes the digestive enzymes, and parietal or oxynetic cells, which secretes HCl. So these three types of cells is present in the cardiac part of the stomach. Now if you see the pyloric part, the pyloric antrum is separated from the pyloric canal by an inconsistent sulcus, name called as sulcus intermedius. The sulcus intermedius separates the pyloric antrum and the pyloric canal. Okay, which is present on the greater curvature. This pyloric antrum is 7.5 centimeters long and these pyloric glands are richest in mucus cells. If you see the pyloric canal, which is about 2.5 centimeters long, it is narrow and tubular. At its right end, it terminates at the pylorus. So this canal ends at the pylorus. Okay, so this is about the parts and the divisions and what are the types of cells present in this subdivided parts. Okay, next we will move on to the relations of the stomach. Okay, so first we will see the peritoneal relations of the stomach. Yes, so the peritoneal relations, as we have finished, what do you mean by peritoneum? And this peritoneum consists of two layers. One is the visceral and parietal layer, and some parts of the peritoneum, both parietal and visceral layers, are coming to contact. Such kind of folds we can given different names like omentum, ligaments, like, isn't it? So what are such peritoneal folds which are related to the stomach? Now we will see. So the stomach is lined by peritoneum on both of its surfaces. At the lesser curvature, it is attached to the lesser omentum. Okay, it is related to the lesser omentum. Okay, along the greater part of the stomach. So if you can see along the greater part of the stomach, that is the greater curvature of the stomach, you can have the other peritoneal relation, that is greater omentum. Okay, that means the two layers meet, that is parietal and visceral layer will meet in the form of greater omentum, whereas in the lesser curvature it meets as lesser omentum. If you see near the fundus, as we know that this is the fundus, isn't it? So near the fundus, the two layers meet to form gastrosplenic ligament. So this is called as gastrosplenic ligament. Okay. Near the cardiac end, the peritoneum on the posterior surface is reflected to the diaphragm. So the diaphragm, it is called as gastrophrenic ligament. So there are four peritoneal relations to the stomach. One is the lesser omentum, greater omentum. Near the cardiac end, it gives peritoneal relation with spleen called as gastrosplenic ligament. On the posterior surface, the peritoneal relation with the diaphragm in the form of gastrophrenic ligament. This is about the peritoneal relations. Now we will move on to the visceral relations. The first relations or the anterior relations of the stomach. Now we will see the anterior relations. So it is divided into three areas. So this is the first area. So this first area is related to the liver, especially the left lobe of the liver. And the second area, so this part is called as second area, which is related to the diaphragm. And the third one, that is the anterior abdominal wall. So the third part is related to the anterior abdominal wall. If you see this is the anterior relations. So what are the anterior relations? So it is related to the liver and diaphragm and the anterior abdominal wall. Now we will move on to the posterior relations. So in the posterior relations, we can find so many things. So the posterior surface of the stomach is related to the structures forming the stomach bed. So what are the structures which are forming the stomach bed? So all of which are separated from the stomach by a cavity of the lesser sac. So here we can see in the sagittal section, this is the stomach. So this one is separated by the lesser sac, and by the side of this lesser sac, that means posterior aspect, behind this lesser sac we will find all these organs which are forming the stomach bed. So these structures are, one is the diaphragm. So here we can see the posterior relations. One is the diaphragm. Next one is the left kidney. Okay, here we can see the left kidney is related on the posterior aspect, and over this left kidney we can have left suprarenal gland. And next one is the pancreas. All these are present on the posterior aspect. Okay, and then transverse mesocolon. So here we can see the transverse mesocolon, which is related to the stomach, and splenic flexure of colon. So here we can see this splenic flexure of colon, and also the splenic artery. Sometimes the spleen is also included in the stomach bed. So all these structures forms the stomach bed, and which are related to the posterior side of the stomach, but these structures are separated from the stomach by the lesser sac. So this is about the posterior relations. Okay, so now we will see the blood supply, lymphatic drainage, and the nerve supply. Okay, so if you see the blood supply, so the stomach is mainly supplied from the celiac trunk. So already we have seen the branches of the celiac trunk, isn't it? So the stomach is supplied along the lesser curvature by the left gastric artery. So this one is the left gastric artery, which is supplied by left gastric artery, which is a branch of celiac trunk, and also a right gastric artery. So this right gastric artery is a branch from the common hepatic artery. This common hepatic artery is a branch of celiac trunk. Okay, this one supplies the stomach on the right side. So along the greater curvature, it is supplied by right gastroepiploic artery, which is a branch of gastroduodenal artery. So on the left side, it is supplied by gastroepiploic artery. Okay, and then this left gastroepiploic artery is a branch of splenic artery. The splenic branches are also coming from the celiac trunk only. Okay, these are the splenic branches which are the branch of celiac trunk. So all the branches are coming from celiac trunk. Okay. So the fundus is supplied by 5 to 7 short gastric arteries, which are also branches of splenic artery. So this is the blood supply, that is the arterial supply. If you see the venous drainage, the veins of the stomach drain into the portal, superior mesenteric and splenic veins. Okay. So superior mesenteric vein and splenic veins, they will and also the portal vein and the superior mesenteric vein and splenic veins will drain the impure blood from the stomach. Okay, now we will move on to the lymphatic drainage. Yes, the lymphatic drainage. So the lymphatic drainage of the stomach is done by the lymph nodes which surrounds the stomach, and this is divided into areas, that is area A, B, C and D. So area A, that is upper part of the left 1/3, drains into pancreato-splenic nodes. So this will drain into pancreato-splenic nodes, and area B, which is a right 2/3 of the stomach, which drains into left gastric nodes, okay, and also the celiac nodes, okay, left gastric nodes and also celiac nodes. And if you see area C is the lower part of 1/3, drains into right gastroepiploic nodes, and if you see the area D, that is pyloric part, drains in the different directions into pyloric, okay, different directions, area D into pyloric nodes and hepatic nodes, and also to the left celiac nodes, okay, and also gastric nodes. So in different ways this area D is drained by different nodes. Now we will move on to the nerve supply of the stomach. So in the case of nerve supply, the stomach is supplied by both sympathetic and parasympathetic. The sympathetic nerves are derived from thoracic 6 to 10 segments of the spinal cord via the greater splanchnic nerves and celiac and hepatic plexus. These will travel along the arteries supplying the stomach. These nerves are vasomotor, okay, and also motor to pyloric sphincter. And these are the chief pathway of pain sensations from the stomach. If you see the parasympathetic nerves, these are mainly derived from vagus. So I have already mentioned about this vagus in the abdominal part. So this anterior vagus, which is giving branches like hepatic branches, pyloric branches, and anterior nerve of letter jet to the stomach. So this will supply, this is the parasympathetic supply by this anterior vagus. Anterior vagus is formed by the left vagus nerve. And if you see the posterior vagus, this posterior vagus is mainly formed by the right vagal fibers, which are also supplying the posterior part of the stomach. So this is all about the stomach relating to its position, size, capacity and external features, and also the subdivisions of the stomach and its blood supply and its lymphatic drainage and nerve supply. Okay, in the next session we are going to discuss about the interior of stomach. Thank you.